So when a patient has made up their mind that they're going to have a joint replacement, it's important to kind of have a checklist of what you need accomplished in order to have that surgery. So first thing, if you haven't seen your primary care doctor in a while, we definitely recommend that you see a primary care doctor just to get an overall check to make sure that you're fit enough to have surgery. If you're deconditioned, haven't been doing a lot of exercise recently, it's helpful to sometimes get set up with some physical therapy and get some prehabilitation so that you can get your muscles strong and get them prepared for what they're about to go through. It's important to kind of evaluate your living environment and see what you might need after surgery. Maybe your bedroom's on the top floor and you want to move it down to the bottom floor or sleep in the guest bedroom. For the surgery, most patients with a spinal, they are sedated, so they don't really know what's going on in the operating room. They're not so sleepy though that they stop breathing on their own, so you don't have to be intubated. You don't have to be put on a breathing machine, which really makes patients feel a lot better after the surgery. Surgeries can last anywhere between 45 minutes to 2 hours, kind of depending on the complexity of the surgery. And then after the surgery, most patients will be numb in their legs for 3 or 4 hours. Their legs will kind of feel like jello. They won't be able to move them a whole lot right at first. But then once that spinal wears off and the motor function comes back in 3 or 4 hours, you're up walking, you're up standing on your new hip or standing on your new knee. Most patients spend the night, although some people do go home the same day, but most people spend a day or two in the hospital. And we generally let patients go home whenever they are achieving their milestones, which is basically just walking safely. Patients always ask, when can they get back to driving? And it depends, but if it's a hip replacement, especially like a left hip replacement, you can get back whenever you're off narcotics, basically. That's any 2 to 3 weeks, 4 weeks, depends on the age of the patient a little bit. Knee replacements, about the same. Work really depends on what type of job you do. If you are in a construction job, it's gonna be a while. It's gonna be 2 or 3 months before you're back to doing really hard stuff with your new joint replacement. If you have desk work, it's really kind of just whenever you feel up for it, whenever you're off the narcotics and feel like you are capable of doing your job. I think one of the surprises is most people are fatigued after surgery for about a month. So it's overcoming that fatigue. You're just not going to have the energy level that you're used to having. Physical therapy is extremely important for knee replacements. And oddly enough, it's not really that important at all for hip replacements. So we allow our hip replacement patients to do a lot of therapy if they want to, or no therapy if they want to. That's kind of just at the patient's discretion. Knee replacements, you have to do the therapy or else you'll probably end up getting a little stiff. The whole day of surgery, the whole recovery process is a lot easier than it used to be. A lot of that's new anesthesia techniques, a lot of it's new surgical techniques, but patients don't suffer. They don't lie in bed like they used to. They get up and get moving a lot faster, and that tends to really make patients recover faster, but then get back to their activities a lot faster.